Hi, I'm Dr. Lucy Horton, an assistant professor of medicine and infectious diseases at UC San Diego Health. Today I'll be reviewing some of the abstracts that were presented at IDWeek 2022. So today the first abstract we're going to look at is the symptom resolution with nirmatrelvir, and this was a secondary analysis of the EPIC-HR study. Now, this study looked at about 2,000 unvaccinated adults who had a confirmed SARS-CoV-2 infection, and they had a symptom onset 5 days or earlier. And this was a population that was majority white, 71%. The mean duration of symptoms was 3 days, and about 75% had 2 or fewer risk factors for severe infection. And what they found was that there was faster alleviation and resolution of all symptoms, except for GI-related symptoms, in patients who had received nirmatrelvir R, and this effect was seen up to day 28. Looking a little bit more into their data, what we can see is that the sustained symptom alleviation held true regardless of how severe the baseline symptoms were. So we can see that it reduced symptoms in the mild, moderate, severe, and moderate to severe groups. And then when we look at patients who had severe symptoms, we can see that treatment with nirmatrelvir R reduced severe symptoms versus the placebo, with a relative risk reduction of 19% between days 2 and 6, and 36% in days 7 to 28. An additional secondary endpoint of the EPIC-HR study looked at in this abstract was the use of medical visits and hospitalizations among the patients in the original study cohort. So what they found was that patients who were treated with nirmatrelvir had reduced number of COVID-19 related medical visits, reduction in deaths, hospitalizations, admission to ICU, as well as overall non-ICU hospitalizations. The mean days hospitalized were 9.6 days in the nirmatrelvir group versus 11.2 days in the placebo group. When we look a little more in detail at the medical visits, what we can see is that COVID-19 related medical visits among patients in the population were reduced in those who had received the study drug. So this includes ER visits, visits to just like a GP or PCP, urgent care, as well as telemedicine visits. And when we look at also at visits where oxygen therapy was required, this was really reduced. So I think this is really important in that we're seeing that the effect of the medication is not just on symptom alleviation, but it's also on utilization of healthcare. And so often during the pandemic, we've seen that when there's a COVID surge, it really impacts the healthcare system. And so this really shows that the effect of the medication is really not just for the individual patient's symptoms, but also for reducing the burden on the health system. Next, we're going to look at another study. And this is the post hoc analysis of the TACKLE trial. Now, the TACKLE trial was a study in over 900 adults who were unvaccinated and not hospitalized, who had mild to moderate COVID-19, and who were at high risk for progression to more severe outcomes because of their underlying comorbidities. These patients were randomly assigned to either tixagevimab, intramuscular injection, versus placebo, and they were randomized 1-to-1. Now, this abstract is a post hoc analysis of that trial. And what they were really looking at was reduction in symptoms through day 29. And so we can see it's a high-risk population. 43% had an elevated BMI over 30, 40% were smokers, 28% had hypertension, 5% were immune compromised. And it was a population that was majority white, but half were Latino. And what we can see is that patients who received tixagevimab had reduction in their progression of symptoms, and this was up to 29 days after infection. And the relative risk reduction was 12.5%. And when we look at specific symptoms, we again can see that treatment with this medication decreased a lot of the symptoms, including cough, fatigue, muscle aches, body aches. There was no difference in duration of fever, but for all other symptoms assessed, there was a reduction versus placebo. Finally, we're going to look at another abstract that looked at repurposed drugs for the treatment of mild to moderate COVID-19. And this was part of the ACTIV-6 study. And so the study population here is about 4,000 adults who had mild to moderate COVID-19. So these are non-hospitalized patients. And they were randomly assigned to receive either ivermectin, fluticasone, or fluvoxamine. And these are all medications that have been used intermittently during the pandemic, but with really kind of lack of data to support their use. In this study, what we see is that there was no significant difference in symptom relief, in number of hospitalizations, or deaths for any of the repurposed treatment. And I think this study is particularly important because it really is a great study, really sound data that shows that these drugs are not useful and therefore should not be used in the treatment of COVID-19, especially since many of them have severe side effects. Well, thank you for joining me today. For more information on COVID-19 treatment, please visit the series landing page at exchangecme.com. And for the latest updates on COVID-19, you can subscribe to Exchange CME's YouTube channel and check back regularly. Thank you.